I'll hand over to Jonathan Bedloe of Mental Choices Tasmania to kickstart the session.
Thanks, Glenn. Welcome, everybody. It's so fantastic to see you all here and have your support for this initiative. I'd like to start by acknowledging the traditional owners of the land on which we're all variously meeting around the country. Here we're in Nipaluna, Hobart, on Lutruwita, Tasmania, the land of the Palawa people. The territory here is actually formerly of the Muanina people, who unfortunately didn't survive colonisation, but we acknowledge elders past and present in the Palawa people and thank them for their beautiful custodianship of our wonderful country. If you'd like to pop something in the chat about the lands on which you're calling in from, please go ahead. I'd also like to acknowledge lived experience that there is likely to be people in the room in the webinar who have lost loved ones, families, family members, friends, and possibly had our own suicidal ideation and behaviours in the past. And so just want to acknowledge that and thank you for being here and your presence and any contributions that you might make. And obviously for all of us to look after ourselves. If you need anything at the end of this call, please do make sure you reach out to each other as well if you're worried about someone particularly. But don't be alone at the end of this if you're feeling confronted in any way by any of it. Briefly, what we want to do from here is give you a little bit of an overview of the report that we've put together. We're then going to go into, before that, I'll give you a little bit of strategic context into how this has come about, this particular report and the Tasmanian context. Then we'll look at the content in the report and hear also from Chris Stone, who's going to join us shortly from Suicide Prevention Australia. He's going to talk a little bit about some of the Suicide Prevention Australia work in the male-specific space. And then we want to give you a chance to reconnect with some others in the webinar to share your perspectives on what you hear, and then come back together for the last few minutes of the session to share those thoughts and ask questions and possibly think about how we might move forward from here. So just to give you a brief context of the situation here in Tassie, we have had a Tasmanian suicide prevention strategy in the past. We've had a few iterations. We're currently in a new consultation phase with a new draft policy to be launched I think before the end of the year. So they've been in a consultation phase for a while. And we've really felt that it's important to put forward the case for a male-specific focus, ideally an action plan within that strategy that really looks at the male-specific context. It's something that really, in many ways, we feel has been missing from the conversation around suicide. We've had attention on some specific population groups, which is all important, and want to see those sorts of focuses continue. However, men as a group themselves haven't really been recognised or had any focus put on them. So we're keen to try and get men identified as a key population group, obviously because of the stats that we all know so well. So we're in that phase of the consultation. We've put in submissions. AMHF has put in submissions to that consultation. There's still some face-to-face meetings and web-based meetings happening to get more specific perspectives that the government are running. And we're hoping to be part of an advisory group that the Tasmanian Community Suicide Prevention Network is hosting, so we're having to be able to put our 2 cents in there as well. So that's a bit of a background. I think now I might hand over to you, Glen, to just give us that bit of an overview. We've got a set of slides. And actually, before I do, I really want to thank Glen and Kim and the AMHF crew, because for us here at Men's Resources Tasmania, we wouldn't have been able to do anything like this report without them. As our national sort of peak body, they've really led the work and have the time, the resources and the energy to be able to put it all together. And we've sort of come in from the sidelines to help out and add some Tasmanian specific information. So thanks for all the help to AMHF. Glen, I'll hand over to you.
Great. Thanks, Jonathan. And equally want to acknowledge the important and awesome work that Men's Resources Tasmania does here. I was chatting to a colleague this morning in Hobart over breakfast, and he asked, oh, has Jonathan been around for a while then? I said, well, I first met Jonathan at the Men's Health Gathering in 2013. And he was working in men's health then. And I don't know how far back your work in men's health in Tasmania goes, Jonathan, but it's at least a decade I know of, probably longer. Whilst the phrase "the smell of an oily rag" is familiar to many of us, it's a phrase that was thrown around in our physical launch this morning as we pleaded for a bigger rag for Men's Resources Tasmania and a little bit more oil. There isn't a organisation like Men's Resources Tasmania in every state and territory in Australia, and that's a big missing. And it makes a huge difference when we do have an organisation that's on the ground, knows the local context, knows what's been going on for over a decade, and can represent both men and the men's health sector. So we are blessed to have Men's Resources Tasmania to work in partnership with on this and other projects, including this lovely report we put together and launched today in the company of both representatives of some great organisations working here in Tasmania and political representatives from every party. So the message was heard amongst both the great and the good. And what we're going to give you now is just a brief overview of the message that we're trying to put across through this particular report. I know we've got people joining us from all around Australia, and I would say that 80–90% of what we're saying in this report could apply very almost just directly to what's happening in your state and territory. It's just some of the contours and the nuances are slightly different. But the case we're making here is certainly a case we could be making in any state and territory. It just so happens that the Tasmanian government is consulting right now on its next suicide prevention strategy. So it's very timely, not just because it's World Suicide Prevention Day tomorrow and Are You OK Day this week, but because the government is looking right now at what the next Tasmanian suicide prevention strategy looks like. And it will be no surprise to you who know us that we think it should have more focus on preventing suicide in men. And I'll just shift to sharing screen and outline our case. So we know since 2020, Tasmania has actually had the highest rate of suicide in the whole of Australia. So that makes this particularly poignant issue. Across the country, suicide rates in men, it's usually 3 and 4 suicides of men. Here in Tasmania, it's more than 4 in 5. Suicide now kills 6 Tasmanian men a month. We've seen the rates of suicide here rising by about 30% over the last decade. And this is at a time when other issues which can cause premature death, like heart disease, like road traffic accidents, they're all reducing. So suicide is going up at a time when other causes of premature death are reducing. And we worked out that basically if we could reduce the level of male suicide to the level of female suicide, it would save the lives of 50 Tasmanian blokes a year. In a state the size of Tasmania, 500,000 people, that's a huge impact. 50 Tassie blokes a year, we could save their lives if we were to reduce the level of male suicide down to the level of female suicide. So this is something we keep repeating. and I think it's really important to get our heads around this. 4 in 5 suicides are men in Tasmania, and yet our assessment of where governments are targeting funding on suicide prevention is that up to 4 in 5 beneficiaries of those funded programs are women. Let us be absolutely clear over and over again, we do not advocate for $1 to be taken away from women's suicide prevention, but when you see that stat, it's a strong reminder that we really need to think about where we are directing funding. And of course, our case is that we should be directing more of that funding at initiatives that are specifically designed to reach out to men at risk of suicide. That analysis comes from a national perspective. So we had a quick look at the most recent funding allocation in Tasmania, which was allocated in May, money mostly from the federal government prior to the last election. We're not able to do a deep dive into this, but our brief analysis suggests that all of the programs funded, all important programs funded to prevent suicide in Tasmania in that latest wave of funding will all reach more women at risk than men at risk. So this is an issue which continues. And the other mechanism that we looked at is the fact that, like many states, Tasmania has a gender budget where it actually analyzes what impact is the money it's spending having on the lives of women and girls. But it's a gender budget, and we assert that being a gender budget, that could also actually ask the question, well, how is the money we're spending impacting the lives of men and boys? And we think that there should be at least a mention of male suicide as an issue in that gender budget. Doesn't currently exist. Maybe it'll be there in the future. We also, some of you will know, did some really detailed public opinion research last year. We did a representative sample of the Australian public, over 1,000 people, men and women, all ages, backgrounds, and we're able to draw out of that what people in different states and territories told us. This is what Tasmanians told us. The vast majority of Tasmanians say they recognise that men and women face different social issues. They think it's okay for government to focus on the fact that men face different issues, and they don't think that we should ignore the differences that exist between men and women, such as the suicide rate. And around 2/3 would actually support additional funding being targeted towards tackling the issues that men and boys face. And it is important when seeking to address male suicide that we actually recognise there are some significant differences between male suicide and female suicide. This data comes directly from Tasmania, from the Tasmanian coroner. So we can see that there are certain areas like relationship breakdown, social isolation, work and financial issues, legal issues, which are very strongly indicated in male suicide. And also we really, and many of you will know this, we really want to challenge the view that this is a problem of men not seeking help. Again, from the Tasmanian coroner, we have clear evidence that the vast majority of men who die by suicide have been in contact with services. When you look over the last year or so, you'll find that at least 9 in 10 have been in contact with some kind of services. 2 in 3 have actually been in mental health treatment of some kind. And then when you look back over just the last 6 weeks, so the 6 weeks prior to their death, over half have been in touch with services, nearly half of those actually in mental health treatment. So this persistent narrative that male suicide is a problem of men not seeking help, it has to stop. It has to stop, because the men are in the system. Some of them are in the mental health system, some are in the broader health system, and many are in other parts of the system, such as the courts. They're in touch with the police, Centrelink, and so on, as well as broader community services. It's not that we don't know where these men are. Many of them are reaching out, getting help, and the help that they're getting is not doing the job. So what do we need? Well, we say that we need an actual male suicide action plan. It could be a separate strategy, could be a separate policy. Simply, we would like to see an action plan that's aligned with the actual new strategy. We've seen one state have a go at this. We know that in Queensland, there's a particular section dedicated to men as a vulnerable population. We'd like something bigger than that, but we think the time is ripe We've been making this case for a long time, but it's an idea whose time has come. Before you start spending your next round of money on suicide prevention, actually sit down and work out what is it that you're going to do to actually address the fact that 4 in 5 suicides are men. Put it in an action plan, make it clear, make it transparent, tell us what you're going to do, test it with us first so we can actually feedback on whether we think it will be effective. And let's develop a plan that's actually designed to reach men at risk of suicide. And we're not the only people saying that. Of course, we would say that, wouldn't we? But other people are saying this too. We'll hear from hopefully Suicide Prevention Australia in a few minutes, and they have identified, this is the peak body for suicide prevention organisations across Australia. They've identified that male suicide is an issue that actually requires funding and policy to be targeted at it by every level of government. Back to our Tasmanians then, and 2 key things that came out of our research was in terms of where they'd like to see funding directed in terms of men's health issues. Their top 2 priorities were mental health and male suicide. And when we asked them what they thought were driving the issues that men and boys face, well, one of the most dominant themes was they felt this pressure on men to be strong and solve their own problems was part of what was driving that. Well, how do we fix that? Is it by telling men they should stop being strong and stop trying to solve their own problems? Well, if it works, do it. We don't think it works. We think we need to actually send a message from the top that actually says to blokes, you don't have to go it alone. You don't have to work it out yourself because we're on your side. We're on your side and we have a plan to support you. We think that actually not only will it practically work to have a specific male suicide action plan, but it signals from government to society, to men, that we are serious about taking care and reaching out and providing help and support. So we want the Tasmanian government very clearly to show Tasmanian men that they're on their side and fully fund a male suicide prevention action plan. That's what today's report is about. It includes 5 specific recommendations. We can come back to those. Won't necessarily go into great detail. Let me pick 2 themes out of this. One, and this is a recommendation that came from the National Suicide Prevention Advisor, Christine Morgan. We need governments to actually audit what they're already funding and spending to actually work out and make transparent what we know, the fact that where they're directing funding is not reaching men. And knowing that, they can then seek to commission and fund initiatives that are actually designed to reach men. This is not a radical idea. It's been done in the world of gender for at least 40 years, but it's only really been focused on women's health. This is what's called a gender impact assessment or a gender budget, and it's recommended by the National Suicide Prevention Advisor. So we want government to do that as part of its consultation process. And then within the broad range of things that we would like to see funded, I think one of the key messages we're trying to get across is that please fund those great grassroots organizations led by men, for men, with decades of knowledge about how to support men, because that's sustainable funding, because those people, those organizations will continue to support men ongoingly, because that's what they're committed to. So those are the key messages of our report. I'm going to stop there, but we're going to have plenty of time to discuss this. And I'm hoping that I'm going to say one thing before I pass over. I'm hoping, firstly, can I get an indication? Have we got Chris Stone in the room?
Hi, I'm here, Glen.
Awesome. So I'll pass to Chris in a minute. I just want to go from my my soapbox to just sharing a bit from the heart before I pass on to Chris. Those of you will know me that I'm passionate about this for many reasons, but one of which is that going through separation as a father 20 odd years ago put me on a pathway that could have led to suicide. I come at this from deep personal experience as well as from a policy and research perspective. We had the privilege today to have one of the local men share his story here of losing his brother, which was deep and profound. What was extraordinary was that the 3 politicians present each also had their own personal stories about male suicide, which they shared. This is an issue which impacts all families and communities in some way, and people really do care about tackling this and making a difference. And hopefully we can harness that concern and that personal experience and actually point people a little bit in the direction of the type of action that we think will make a difference. So that's all I want to say for now. I'm going to pass over to Christopher Stone, who's done extraordinary work at Suicide Prevention Australia, putting together their work on male suicide, something which didn't exist a couple of years ago. And I'm going to hand over to Chris to share a bit about the work that Suicide Prevention Australia have been doing.
Thanks heaps, Glenn, and thanks for having me here. It's really great to be here. And I should add that really the work that I did is actually just putting together the work that we've heard from experts like yourself. But I'll get to that in just a moment. Just to introduce myself, I'm Chris Stone. I'm the Policy and Government Relations Manager at Suicide Prevention Australia. Suicide Prevention Australia is the peak body on suicide prevention, and we have over 300 members across the nation, and that ranges from the big names that you all would have heard of, Black Dog, Lifeline, etc., but right down to local organisations, grassroots organisations serving their communities, as well as researchers and leaders across the sector. Suicide Prevention Australia has had for a while a focus on male suicide prevention. Our CEO talks about addressing the big rocks. That fundamentally we know that 3/4 of the deaths by suicide are men. So if you're not addressing male suicide, you're not addressing 3/4 of the problem. So suicide prevention has been calling for some time for a national male suicide prevention strategy. And indeed, for the same reasons that applies at the national level, it also applies at every state level. What I want to talk about here, one of the things that we felt in arguing for a male suicide prevention strategy is not only arguing about the need for it in terms of addressing the significant issues that we know are there, but also saying what it would do. Giving some idea of what a strategy would look like, and that's what we feel is important. And so Suicide Prevention Australia committed to doing a piece of work co-designed with expertise from people who know what they're talking about, trying to identify the principles for a male suicide prevention strategy. So I was brought into that project, and what it meant was that I had the privilege of working with 30 experts on male suicide prevention. And when I say experts, what I'm talking about is there were men with lived experience who had been there, who were part of that group. There were also people in that group who were with service organisations, some grassroots, some large, who had, as part of their organisation, helped thousands of men who had been there. As well as that, we also had researchers who dedicated years of work on the issue of male suicide prevention. And indeed, many of the experts that we put together in that virtual room were two of those things, or all three. And so it really was quite an amazing group of people to work with on looking at what a male suicide prevention strategy would look like. I should mention that a few years ago, I came across the phrase that if you put 3 experts in a room, you come out with 5 opinions. So you can imagine that when we put 30 experts in a virtual room, we had quite a few opinions. But one of the great things about this work was that there was also a great deal of consensus about the fundamentals of what we need to look at in a male suicide prevention strategy. So what I'm going to do right now is just share my screen and pop up a few slides and just take you briefly through what we identified. And that was kind of 4 key principles for male suicide prevention strategy. And I am hoping that
we can see it. You might just want to enlarge.
Yep, has that enlarged now? Great.
Perfect.
Okay, so the first thing that that this group of experts could all agree on was that the strategy needs to ensure that supports respect and value men's strengths. Now that's an obvious statement. But digging into the detail, they were able to give a bit of some pointers as to what it is that makes services something that men will hopefully engage with. And Glen was indeed just mentioning the significant problems we have with men who do actually reach out to services, but don't stick with those services because they're not giving them what they want. So they talked about the fact that supports need to go where men are. That peer-led supports are a really important part of the mix, and we need to make sure we have those in our system. That they are taking a strength-based approach, appreciating that men have strengths, and that they're providing tools that men can use in their everyday lives outside of the service context. A variety of modes of engagement are important. You know, we need face-to-face services, we need phone services, we need online services to address the different needs of men out there. We need consistent and long-term relationships being able to develop, and that's partially about security of funding for an organisations, and also partly about peer-based services, which can often have those lasting relationships. And finally, of course, we need an integrated and collaborative approach so that services are working together, particularly peer-based services working with clinical-based services. So that was the that was the first principle that we feel that the strategy needs to address. A really critical thing coming out of the discussion with this group of experts was that we need to take a situational approach. We know that men have many fewer attempts on average before they unfortunately die by suicide if that happens. And so there are less opportunities to intervene. And what that means is that we need to be reaching out not only to where they are, but when they are in situations that put them at risk of suicide. You'll see on these slides, I put up a list that came from this expert. I won't read that out, and indeed you may not be able to read it. The fonts had to be small to include it, and that is just an indicative list. But there are a number of situations that we know put men at risk of suicide, and we need services that actually reach out under those circumstances. To ensure that services are reaching out in those circumstances, the experts talked about that support is being delivered in the critical times, and key touch points are being identified by having connected training. This is sometimes also called gatekeeper training, which is not a term we prefer. We prefer connected training as more descriptive, but this is about having, training up perhaps men who are in situations where they will encounter men at risk. And that might be a Centrelink officer, but it may also be a barber or a doctor. But we need to identify those men in critical positions and give them connected training. We need better referral pathways. Again, this is about these linkages between services. And we also need targeted promotion of where supports exist. One anecdote about the difficulty of getting up a poster in the family law court about help for men. There are situations where we know men are at risk, and we can target those situations to provide them with information about support. So that was the second principle. The third, very important, about supporting men in all their diversity. Men obviously aren't a homogenous group. And there are a range of different ways in which they differ. Age cohorts, culturally and linguistically diverse backgrounds, whether they're Aboriginal, Torres Strait Islander, or have disability. And again, this is a lengthy list and probably only an indicative list, but it's really important that services are competent to deal with the full range of men that are out there. And finally, the fourth principle, and that is that government actions need to be informed by essentially this broad range of expertise, as indeed this work that we did was informed by it. And that includes lived experience, support provision expertise, so support provider organisations and community groups, research and data, and making sure that all of those are part of whatever actions government take. And there was, in the report that came out of this work, there was some advice about how to ensure that happens, ensuring, having a diversity of lived experience and representative lived experience, operating through multiple mediums, multiple different ways of reaching out to men, because different ways will work for different men. But also consultations, making sure that those consultations happen early, and co-design and implementation, and in evaluation, that consultation happens all the way through. So look, that's a quick summary of the report that we did coming out of this work, these 30 experts. It is available on our website if you wish to have more detail, and I do encourage you to look at it. But hopefully that's helpful in terms of making the case for a suicide prevention strategy in talking about what it is. Glenn, I'm not sure if there's time, but I'm happy to take any questions if that's appropriate at this point.
Yeah, you've taken up more time than expected, which is fine because it gave you the chance to go in detail. Be one quick question, I think, and I'd really like to ask what's next in regards to suicide prevention in Australia and this piece of work. What do you do with it now?
Yeah, absolutely. And this is really important, indeed, in all of our work, is that you put the big report out there, you hopefully get some media attention on it, and that drives the politicians' attention. And then the next step occurs behind the scenes. And that's what we've been doing since we released the report. This is about talking to politicians, both at federal and at state levels, and saying, look, we know that this is needed, and we also know that this is what it needs to look like. We've spoken to those with expertise and trying to persuade that to happen. So that's in broad strokes the process of what's next.
Great. I'll just see if there's any burning questions for Chris, because I know you've got a pop off. We've squeezed you in at very short notice. So,
Yeah.
Glen, it's Graham Holdsworth.
hey, Graham, go ahead.
I'd like to add another one. And Chris,
Chris, can you hear me?
Yes.
My internet's mucking around.
Sorry, I don't know who that is, but I've got Graham Holdsworth speaking here.
I was just going to say there's another bit of work that Suicide Prevention Australia did on men's suicide that's probably worth talking about. It was a mapping exercise that was done with the cooperation of KPMG, which mapped the whole process of men and suicide and their touch with services. That is another one really worth looking at, it because it shows us that at the different points the men had touch points with people that could give assistance and what happened from it.
Yeah, you're absolutely right, Graham. Yeah, that piece of journey mapping, again, is available on our website. And yes, really important, and leads into that point that I made about the fact that there are limited opportunities, but definite opportunities where we need to be reaching out to men who are in crisis or at risk of being in crisis.
And was it, thank you. If anyone could grab that and post a link in the chat box, I've posted a link to the Suicide Principles report. Graham or Chris, if you're able to find the KPMG report and link it, fantastic. Looks like Peter Clark wants a question, and then we'll have to move on from there. Peter, did you want to ask a question? Your hands up.
Yeah, I'm sorry, I went offline again there. Chris, I work with the Omni Men's Discussion Groups program in Victoria, and our approach is really going right back to the pre-suicidal contemplation, going to encouraging relationships and communication, confidential meetings which enable men to confide issues in their lives. And I wondered whether what I've heard from you so far, and also from Glen, is a lot about addressing people who are already at serious risk. And Glen's stats, you've got to recognise, although they're awful, they are a statistic taken from a cohort of people who are seriously unwell mentally and contemplating suicide. I like to go back a step and provide men with ongoing fortnightly discussion groups.
Okay, Peter, thank you. That's understood. Chris, any thoughts on that piece about, I mean, we're talking here about protective factors and building resilience, right? And the importance of social connection.
And Peter's absolutely right. You know, it's important to kind of move upstream. And this is part of like identifying men not just in crisis, but at risk of being in crisis at those touch points and reaching out at those touch points. So yeah, absolutely.
Great, and thanks, Peter. Thanks for the great work that Omni does. That's Older Men, New Ideas. It's one of the many kind of men's social connection type groups that are connected with the Australian Men's Health Forum and doing great work to build a community and support for men around Australia. Chris, thanks for your time. Stick around if you can, but we understand you have to shoot off, and we'll what help do you want from us, from the sector? What can we do to put wind in the sails of this report?
Look, absolutely. I would love it if people are talking about this report, whether on social media, if you're on social media, or if you're ever in contact with decision makers, please do point them towards this report as something that could be useful.
So maybe popping it in this report here and telling people about it, which we did.
Absolutely.
I was just about to say it's a two-way street. Suicide Prevention Australia should also take up your report on Tasmanian and make sure that it progresses to the right places.
Plans are in place.
Are you still on the board, Graham?
Yes, I am, Glen.
Excellent job, but we'll make sure that you've got a big pile to point towards people.
I look forward to getting them.
Great, thanks, Chris, and thanks contributions there from Graham. And the question from Peter. Look, the way we've structured this, we've done a lot of talking at you just now. We want the opportunity for you to all contribute in some way. Obviously, in 20 minutes, not everyone's going to get the opportunity to contribute. So what we're going to do is we're going to drop you into Breakout Room for 4 or 5 minutes. And with that group of people, just have a chat about what you've heard, what your thoughts are, what your experiences are. And then we'll bring everyone back for a final sort of joint conversation to wrap up. So I'm going to hand over to our production team again. and ask them to send you off into some breakout rooms of 4 or 5 people, just so you can share some reflections and thoughts and ideas on you know, what you've heard, what you'd like to see included in a suicide action plan. Share your experiences with each other. Hopefully you'll get to meet some new people as well. So I'll say this a couple of times. We are really keen to hear from all of you, and probably won't be able to. So please also use the chat box to contribute. We are going to preference, if possible, people based in Tasmania. We'd really like to hear from the Tasmanian services and people who have got that grassroots Tasmanian experience, because that's what today is all about. We also welcome contributions from the mainland, but if you could please, you know, speak up and chime up if you're in Tasmania, because we will preference your contribution, and we'd love to hear from you. So maybe for those of you familiar with Zoom, if you could find the hand button, which is in the reactions section. So in the toolbar down the bottom, there's a little section called reactions. But I'm also going to ask Jonathan to have a look around the room and see who's there from Tasmania, and actually maybe tap a few people on the shoulder and say, yeah, well, what did you think from your perspective? Tell us a bit about what you're doing or what resonates, because we really want to hear some Tasmanian voices. Yeah,
I'm wondering if I might tap Chris Fowleracre on the shoulder. He's a representative with Tasman who run the men's gatherings and men's groups around the state. I'd love to hear any thoughts you have to share.
Thanks, Jonathan. You just put me right on the spot. I love you, mate. Yeah, look, it's interesting because at the moment, Tasman is going through a process, a visioning and mission statement process, trying to really sort out what we're here for, but also the best way of engaging men. And I guess from our point of view, you know, one of the most important steps is having a process or a service or someone who's out there who can actually engage with men. And that's going to depend a lot on, obviously, the man involved, and you know, different strokes for different folks as far as that's concerned. You know, the men's, you know, looking after mates, etc. Even the Bunnings barbecues. It's amazing what creates opportunities for men to engage and, you know, to actually talk. Yeah, so I think from us, that's going to be one of the big steps, is how do you create those services, those environments where, yeah, men have the opportunity to engage in a safe environment where they don't feel judged, where they feel supported. And it's not a case of fixing men, but supporting men, right, or caring for men.
Yeah.
Yeah, look, I'll leave it at that.
Thanks, Chris.
Yep.
Thanks, Chris. That's fantastic. And I think there's lots of things we can point to, and some booklets and resources we can share as well, which we will do. David Wilkes up in Lonnie.
Thanks, John. Well, it seems so obvious, the things that you say, and yet having worked in the sector for over 15 years here in Tassie, it's extremely frustrating that what you say is not accepted by the mainstream, and services are set up and they're unconsciously biased, and they don't realize that they're biased against men, and initiatives against men. And, you know, yeah, the myths still persist, Glenn. You know, I work with guys, and you're right, I work with guys, and they've seen other services before. You don't get to see me if the other services work. You only get to see me if the other services don't work. And those working class guys, when I ask them, well, what's the difference with me? And they say things that are quite surprising to me, like honest, straightforward, no BS. You're not sugarcoating it, are you? No, I talk how it is. I got to use plain language to interact with the guys. I use my lived experience, selective self-disclosure of my lived experiences and the challenges that I've faced as a man, and sharing the lived experience of the other guys I've worked with to reduce that isolation, because they all feel, whether predominantly feel, that they're going through it alone. And of course they're not. That's a myth, you know, that they're not going through it. There's nothing you could tell me that I haven't heard other guys say. So breaking down those myths, service providers being brave enough to use their own selective self-disclosure, and services that are set up to meet the needs of men. And that's not us sitting in a closed room talking over a table. It is supporting an outreach model where we can take guys for a walk, take them to places where they are able to emotionally self-soothe, whether that's by all the gorgeous scenery that's around us. And my experience in making that effort as a service provider, doing a longer appointment, taking a guy like I did this morning to the gorge, and then they can really get off their chest how they're feeling and what's real about their lives. So final words, thanks to Glen and John for all the work you do.
Thanks, David. I just want to acknowledge Julie Ryan's comment from Carers Tas. There is a particular youth suicide survey out at the moment, and I believe that I've heard from the department that they're actually happy for anyone to fill in those postcards that are out around the state. So if we want to get men to fill out their thoughts and perspectives, they're more than happy to hear that. And also, I think we can say we have had some success with this strategy and getting men identified as a vulnerable group. We weren't listed initially, but they have acknowledged that that was a gap. And so whilst it may not be in the paperwork, I think we have done the job of getting it on the map. I'm wondering if I can, and sorry, I should actually ask Julie, would you like to speak to that at all?
Thank you. Yeah, I just wanted to pop that down before it disappeared out of my head, but I thought that initially it was really interesting that in most strategies and consultation phases they do list the main target cohorts, and males were not listed in there, which is crazy given the statistics. They should probably be the highest priority group.
Thanks, Julie.
Thank you.
I'm wondering if I can drop another person in it. Michael Fumard, your name is familiar to me. I'm not sure if you've got anything you'd like to add or contribute, or if you just, go for it.
Thanks, Jonathan. Yeah, we've been around. I think you've been around for about as long as I have in Tassie. I think in our little breakout room, we talked about that it was news to me about, 9 out of 10 Tasmanian men are engaged with community supports. And what it made me think was that the services that exist must therefore be not effective, for men in that context. I suppose a couple of thoughts, and just in probably 3 thoughts, and a bit of a plug for Standby support after suicide. Along with suicide prevention, I think Australia, we've worked pretty closely to identify clearly men as a target cohort for us. So I think that's a small step, but it's an important one. I think I want to echo what David said in terms of some of my experience of work with men. Men, and you can't really generalise, but men seem to do way better with side-by-side conversations rather than face-to-face. And I think we need to pay attention to that and figure out services that enable that and allow that and encourage that. I think too, I want to, I don't know if it was you, Chris, or someone else who talked about some of the implicit unconscious bias, maybe that was you too, David, towards men. That's such a big thing, and because it's an unconscious bias, we're not actually aware of it, obviously, by definition, and so that's a struggle for us. One of the things that strikes me is what, in terms of that, what some simple things that we might be able to do about that is, we need to be able to encourage men to say, so what I think is men probably have a bit of a crack at one form of support, or maybe multiples, and then feel like they failed client 101 if it's not working for them. And we need to make it really easy for men to say, this is not working for me. What else have you got? You know, and put the challenge back onto us as, you know, failing service provision 101, really. So there's a couple of random thoughts, but appreciate the chance to share them. Thanks, Jonathan.
Thanks, Michael. So we got a couple of minutes left. I'm wondering about whether I could ask Anne-Marie Byrne. I'm not sure where you are, but I think a rural financial counselling service, I believe you're with. I think this is the sort of service that's really important, because financial problems are probably one of those top areas where men feel that distress. Can you talk to that at all, Anne-Marie?
Yeah. So I previously did this role elsewhere, and then Rural Financial Counselling acknowledged that, like you guys have just said with your stats, 9 times out of 10, the financial and the relationship and the mental health all explode at the same time. So it was a no-brainer for me to come and work with Rural Financial Counselling. So this conversation is so good, because I'm running around everywhere trying to tell services how to work better with men. I'm just thinking, has anybody ever done a checklist or a, you know, this is what services should be doing? Like, for me, outreach is number one. Don't make them come to a bloody office. They're not into it. And definitely, like you just said, side by side, absolutely, whether it's going for a walk through the paddock or pulling a calf or sitting in a tractor, like side by side is definitely the way to go. And that, you know, like I was saying in our little breakout group, when I send a farmer to a counsellor, if it doesn't happen the first time, they won't go back. And we've also got the issue where it's really hard to find counsellors here at the moment. I'm in Southwest Victoria. The books are either closed or they're not doing it. And a lot of counsellors through COVID realised that it's cheaper and easier to work from home online, so that all the outreach ones disappeared. So yeah, they're my little issues, but it'd be not, oh, okay. 10-step guide to developing male-friendly services. Thank you very much. I will download that now.
Yeah.
Thank you.
And just to pick up on that, so Glen's just put that link into the chat, that there is a great resource there that Australian Men's Health Forum have put together, and there's a number of resources like that, and I just cannot speak highly enough about those things and recommend them. It's still a challenge getting this information out there, but there is increasingly information there.
Yeah, and you spoke to rural men, and when we've had specific events on rural men's health, one of the messages I always remember very strongly, and all of those principles that we talk about apply in that report in a rural context. But the thing is, we get told we're rural first and men second, and so it really does need to be adapted. I mean, the things that you said, getting out on the tractor and stuff, it does need to be adapted to that rural context. But there are great examples of services out there who are doing that really well and talking to rural men in their language. So you don't have to reinvent the wheel, but it's great that you're asking that question.
Glen, thank you for sharing those 10 points. Is it possible for you to also share your slide presentation today?
We'll send out the slides and a recording.
Thank you very much.
Yeah, I'll just get that clear in the wrap up, which we're coming to. JB, anything from you?
I would just like to thank again everybody for being here, for your support with this initiative. I'm going to chuck a link in the chat as well to Spruik, our International Men's Day breakfast, which is a bit of a fundraiser for us. 18th of November, if you're in Hobart or if elsewhere in Tassie and you'd like to Zoom in, we're hoping to be able to Zoom people in. So, but otherwise, thanks so much to Glen and the MHF for all that you do.
No, thank you, Jonathan. We wouldn't have been able to do it without you. It's been great to have the opportunity to make Tasmania the first place that we've done this level of initiative. We hope to replicate this across all the states and territories. Victoria is next, just because Victoria is also currently consulting on its strategy. So for those of you coming from Victoria, get in touch because we're bringing this initiative to Victoria. I want to acknowledge the many great men's organisations working in Tassie. Jonathan, jump in if I miss ones here. But from today, we were joined by by Men's Sheds. We had a representative from Tasman. We've had the DIY dads in Hobart, and a representative from Parents Beyond Breakup, who run Dads in Distress. They run an online group for Tassie dads in particular. And I'm aware of also Tas Dads, Tasmen, Man Up, the Greg Smith and his various work in the Northwest, including the Man Walk and Mr. Perfect Barbecue. Whom am I missing?
Men's Table,
of course.
and Hobart now.
Yep.
And
So
there are small initiatives going on around the state as well that sometimes we don't hear about. There's a small group of people meeting in Risdon once a month to look at how we engage men. So,
great. And Barbers for Life, Launceston City Council initiative as well.
Monk and Co in Hobart. Another one.
Loads of great work happening. We want to see more of that. There's great knowledge in the sector. My final request to you then is I've got the wrong link now because I just went Googling the 10 guides. We have got a link on our website which provides all of the key resources on this particular campaign, and it includes a little petition for you to sign and send a message to the Premier if you would. I'm linking it now. You can download the report there. You can download various social tiles, which we encourage you to share. You can download the key fact sheet. The presentation slides aren't there, but we'll make sure those are circulated with an after event email, which will also include a recording, not of the breakout rooms, but of the main room sessions. I just end by thanking you all for taking an hour of your day to be part of this very important conversation. Really fantastic to hear from practitioners working here in Tasmania and hear your experience. Thanks for all you do. Keep fighting the good fight, because together we can make a difference. Thank you, everyone.